Welcome to Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Elliott Robinson. He's a board-certified orthopedic surgeon and he's also fellowship trained with a certification in hand surgery, and today we're going to talk about his practice in Central Georgia. Dr. Robinson, thanks so much for being with me.
Great to be here, Cindy. Thanks.
Would you tell our audience to begin with a little bit about the hand and why you specialize in hand and elbow surgery, but hand first?
Yeah, I think hand surgery is special in that it involves care of so many different types of tissue. We call it a composite organ in that the bone, the tendons, the nerves, the arteries are all equal in the outcome. An example would be if you can get a bone healed but it's very stiff, then the outcome isn't nearly as good as if the tendons are gliding properly. And so the specialty, it was actually the first subspecialty in orthopedic surgery, and it was developed after the Second World War. And the idea was to help rehabilitate a lot of survivors with traumatized limbs. And they started melding techniques of plastic surgery and orthopedic surgery and developing techniques really to assess that composite organ and try to improve people's outcomes.
As a surgeon, as a hand surgeon particularly, you look at both accidents, things that happen to the hands, and medical conditions of the hand?
Yeah, so actually one of the things I really like about my job is I get to meet people through kind of all phases of their life. Some of the more dramatic things I can help people with are the acute injury. You know, I do meet people who have bad injuries, whether it be from a car accident or a saw injury or something that's really going to affect them, and I can do my best to rehabilitate their hand. But also I'll meet people who have more chronic problems, arthritis, pain from a nerve compression like carpal tunnel, or you know, kind of weekend warrior type of accidents like maybe a torn biceps tendon or something like that.
When you talk about the pathway as a surgeon, once you've completed the procedure, how does the patient progress to being completely recovered? They go through rehabilitation?
Many times we'll maximize people's outcome by sending them to therapy, and I think that's a luxury that I have at Ortho Georgia, is having a fantastic certified hand therapy team. We have many extremely experienced, very dedicated individuals, and one of the great things is they're just down the hall, so they'll often just stop in and make sure that they've got a plan kind of as dialed in as they can. So yeah, therapy plays a big part in hand surgery, yeah.
When it comes to injuries of the hand, you know, people think about the thumb as something that differentiates humans with the way that we use our thumb. Can you tell us a little bit about why the thumb's important to this composite or this system in the hand?
Right, and so because the opposable thumb allows us to grasp objects and manipulate them, they say it's about 40% of the function of the hand. And so if someone were to accidentally remove their thumb with a skill saw, for example, I'll work for hours under a microscope to try to reattach it. If somebody comes to me with severe arthritis at the base of their thumb, that can really hurt them and hamper their function, even simple things like opening a doorknob or opening a jar. And I treat lots of people with thumb arthritis. Sometimes it's as easy as just some over-the-counter medication. Sometimes braces will help, or injections. And if that doesn't work, then a surgery has been shown to help people get a lot of pain relief at the base of their thumb.
When it comes to working on the hand, tell us a little bit about your fellowship and your certification with hand surgery specifically.
Right, so after medical school and 5 years of orthopedic surgery training, I decided to do an extra year of dedicated hand surgery fellowship. I did that at University of Virginia, and basically just worked with hand surgery experts, just taking care of the hand day in and day out. And once you complete that, you can sit for a test to get your added certification in hand surgery.
Mm-hmm. Why did you pick orthopedics and then subsequently hand and elbow as your area of specialty?
Yeah, I think like a lot of orthopedic surgeons, I just like fixing things. You know, I like to have a craft, I think is one way to put it. I think taking care of people's function is very satisfying. You know, at the beginning they come with a very specific problem, and if you can fix it or resolve it, that's sort of kind of innately satisfying for somebody who likes fixing things. And so I think orthopedic surgery was sort of a great fit for my personality. Hand surgery, I think, really can make a difference in people's lives because, it's funny, my patients will tell me, Doc, I use my hands all the time. And, I think we use our hands for, to interact with our environment. Some people, even it's crucial for communicating. You think about sign language, but most of us will actually use our hands for communicating, gesturing, whatnot. And so I think restoring kind of this this unique structure with how we interact with our environment is particularly rewarding. I also like the technical side of it. I like operating on nerves one day, or arteries the next day, or bones the next day, etc. So it gives me a really nice variety of things I can do to help folks.
When it comes to the hand and the elbow, we talk a lot in this program about hip and joint replacement, hip and knee replacement. Are there joint replacement opportunities in the hand and in the elbow also?
There are. When people have severe arthritis in the hand from something like rheumatoid arthritis or severe osteoarthritis, sometimes I will do joint replacements in the digits. Mm-hmm. Okay. The elbow is also an area that's less commonly replaced than the hip or the knee, but it can make a big difference in people's lives after severe trauma or bad rheumatoid arthritis. And able to position their hand in space. If you can't get your hand to your head, then you can't feed yourself, you can't dress yourself, that sort of thing. And so sometimes a total elbow arthroplasty or replacement is necessary.
When patients come to your office, other than in an acute, for an acute procedure like an accident, what's the path that you take them through addressing it? You mentioned a little bit more about medication and then eventually to rehab. What's the conversation like when they first come in for your assessment?
Sure, I think it really depends on what their problem is and what their needs are. I think if someone were to come in, for example, for thumb arthritis, I think the first step really is to listen. How much is this bothering them? What are the specific things that they can or can't do? What have they already tried, okay? And then you can tailor your treatment plan. It may just be, kind of lending a compassionate ear and giving them information. That may be all they need. They may want something more like a steroid injection to get them feeling better. If they've had an accident, and maybe talking about getting them to the OR soon, for example, and getting them fixed so they can get on with life. So I think it really depends.
If a patient is watching today and they realize they have arthritis of the thumb or they've got carpal tunnel, something going on with their hands, how do they normally get referred to you when you're a subspecialty even in orthopedics? Yeah,
I think it depends. Sometimes they will call our office and make an appointment and we'll be happy to fit them in. Mm-hmm. Some people have a specific insurance that requires them to get a referral, so sometimes that's a little bit of an extra hoop they have to jump through. Mm-hmm. I do get referrals from primary care physicians who recognize a problem in their patients and will send them to me to evaluate and take care of. Sometimes I'll get referral from other orthopedic surgeons who recognize that this is needs subspecialty care.
All right, well, thank you so much for telling us about your practice. We appreciate it. And thank you for joining us at Navicent Knows Health. If you'd like to know more about Dr. Robinson and his practice at Ortho Georgia, please visit us at navicenthealth.org.